Hi, my name's Elaine, and I'm a physical therapist here in Eagle River, Alaska. And I just wanted to go a little more in depth into what's called the cervical spine. So we're going to do some involved stretches today, and always consult with your healthcare provider before starting any exercise program. But today's pretty gentle. A lot of my clients are having to sit in these kind of chairs, with their online meetings or even at work or at home. So I just wanted to talk a little bit more about some better seated techniques and some little exercise hacks that you can do during an online meeting. But before going there, I just wanted to talk a little bit about the spine. And this is not my last patient, okay? So this is a plastic model of a spine. And in the cervical spine, I'm going to just bring that a little bit closer to the camera there. Hopefully you can see that. But in the cervical spine, typically we have 7 cervical vertebrae, and then it almost looks like an upside down V. So this little joint right here, that's called a facet joint. So when you're doing neck stretches, and I encourage you, check out different videos online. Reach out to me if you have some questions. But I'm seeing some videos that it's like, wow, this may not be the best thing for your neck. So these little facet joints, and this is the front of the spine, and this is the back of the spine. Okay, hopefully that makes sense. So what I'm seeing is way too much cervical extension on some of these videos. So here, if you kind of watch these little joints here, so cervical extension would be in this direction. So that's like taking your head up, and what it does is it jams up these joints in the neck. So if you have any kind of arthritis, any kind of bony issues in the neck, these kind of like neck rolls, whoa, they can really irritate the neck. So I don't really emphasize a lot of extension in my Physiolates classes. For those of you that have come to my classes when I used to have them in person, which we will do that again, the emphasis is in neutral flexion, side bending, or rotation. So we're just going to do just a few exercises. If you're feeling neck tension and maybe headaches, end of the day, middle of the day, watch your posture in your chair. So I'm catching patients, I'm going to go really sloppy here, where they're kind of forward, typing, kind of like this. So you can see how head forward I am, just working here. Or I'll see kind of slopping in the chair, collapsing, jamming up. I call Larry King Live, jamming these shoulders up. So you're kind of sitting like this. And it, initially it feels comfortable, but it's really hard on the neck. So take little mini breaks throughout the day, do the best that you can. I know sometimes we're stuck in our chairs. So one thing you can do is take your arms off the armrests. A second thing you can do is kind of take breaks from the backrest and just rely on your deep core muscles, actually. So if you're sitting with good posture, say in front of your computer, your monitor, without that backrest, you're actually doing quite a bit of work for the back. So if you're able, go ahead and just come away from the chair. If you are feeling that neck tension, maybe those headaches, kind of an inside tip, I prefer, and I don't like to promote brands, I'm not doing that, but doTERRA, Young Living, some of these nicer essential oils, that you're getting more of a pure product. So if you have your preferred brand, that's great. But this is Peppermint essential oil. And what you can do, if you have sensitive skin, maybe get a couple drops of coconut oil first. But if your skin is not sensitive, just 1 or 2 drops. Let's see if I can get this to come out. There we go. I've got 2 drops there. You don't need a lot, just 1 or 2 drops. And again, this is if you're feeling like a headache is coming on, you're feeling that tension, you're just going to rub that in, and then very gently just taking your hand, like the palm, and you're just gonna kind of work that into the neck, okay? So you can keep the head neutral. If you're able to take the ear to the shoulder, and you're just gonna come from the back to the front. You listen to your body, you just go as deep as you want, okay? Not forcing. It feels really good. This is some nice self-care that you can do. If you want to, like, if you're in a meeting, you can maybe turn off the screen if you're able. You wouldn't want to be doing this in front of anyone during the meeting. So do that about 3 to 5 times, and then switching sides. You're just going to take that other hand, and then again from back to front, using that whole palm, and keep your head neutral. Or if you're able, I'm just smelling that wonderful peppermint oil. I don't know if you can smell it too. It's very nice, very cooling, very relaxing. Good. Just working that into the muscles. Good. Just a couple more. Good. Very nice. Okay, sometimes patients are asking me, can I use peppermint oil around my face? Just be very careful. A lot of my clients get headaches in the temple area. So very carefully, you can take just micro drops of that peppermint oil and just work at the temple and work back. Okay, so just doing it back and up. Okay, so kind of a back and up in the temple. Stay away from the eyes. Okay, be very, very careful with that. So a couple of those. And then you're going to cup your hands. And then deep breathe. Deep breathe into that peppermint oil. That is so wonderful. That just gets into the whole system. And I don't know the organic chemistry behind it, but it will just relax the whole system. Breathing in that peppermint oil just really relaxes the whole system. So that's a great way to kind of prep the area. Let your upper neck, upper shoulders relax. And then we're just gonna go into a few stretches. This won't take too much longer, but just take your time. Just want to take the head all the way down. Feeling that in the back of the neck only, making sure you're not having any pain. Just turning to the side here, and you can take your hand, just again doing some self-care, and you're just taking the whole palm of the hand and just gently squeeze the neck, just like you're squeezing your palm together. Okay, so I'm going to turn just a little bit more. So a couple squeezes. Listen to your body, make sure it feels good. Very nice. Great job. Good. And slowly release. Starting from C7, this lower vertebrae, you're just going to roll up one vertebrae at a time. And then roll those shoulders back. Nice. Very good. Okay, and then take a little more time. So you can take one hand on the opposite side of the neck, kind of like what we did earlier, but you're just going to take the hand and very gently rotate the neck. So going easy, looking from one shoulder to the other. Little rotation, not too hard. Going just right a little bit over. You've got the carotid artery here in the front, so you don't want to go too hard. Listen to your body. You're trying to get a little bit more into that meaty kind of shoulder where we have so much tension, and rotate that head. Let's do it one more time. Good. So we're just doing a nice rotation. Beautiful. And then opposite. So you're just taking the hand, swiping and turning. So as the hand comes towards the center, head is going opposite. Hopefully that's making sense to you at home. Good. Let's try 2 more. This feels so good. Very nice. Great. Good. Beautiful. And come back to center. Roll those shoulders. So if you aren't sure about the peppermint oil, you don't have to do this with peppermint oil. You can just do it with your hands and your skin. You can use a little lotion, whatever you like. And if you want to maybe test the peppermint oil, you can just do like a little test on a small part of your skin, making sure you don't have a reaction to it. So there's a little inside tip for you to just kind of break up the day day when we're stuck in our chairs, whether at home or at work. If you have any questions, feel free to email me, contact me through the studio at 907-622-2327. And I hope this upper body tip helped, and I can't wait to see you again in class. All right, thanks a lot. Bye-bye.